Another episode with Dr. Dora Evangelidou and Dr. Elias Zgheib, both of them onboarded on the Mia journey probably a few months ago. And welcome. Thank you for joining me this morning.
Thank you for having us.
It's always a pleasure, Dora. I will start with you, actually.
Okay.
And I see you're matching your colors with Preservé.
Of course.
But we'll start with Mia. So how does it feel now, a few months into the Mia journey, from a patient perspective? Because I think at the end, Mia came in to offer consumers a new, less invasive solution. So which market are you seeing Mia addressing now?
Actually, it's very interesting. Mia is addressing not the plastic surgery market. It's addressing people that they never thought of having plastic surgery. And it's really exciting because we didn't have any innovation in the breast surgery since 1960s, like 62, where the implants were invented, and then we changed a little bit the implants, water field, saline field. But the real innovation in the surgery technique to address the problems of the people that they don't want to have surgery, it came for the first time, and I'm hooked. You can't imagine.
So that's we should also mention you're the first female surgeon in the Middle East to perform Mia.
I'm so proud. I'm so honored, really.
We're proud of you as well.
Thank you.
Dr. Elias, what's your thoughts in terms of now several months into the journey? What's the feedback you're getting now overall from your consumers?
So the procedure itself is tapping into a certain demographic that you usually don't see in your clinic. You know, women that are too busy to even search for any procedure, and so they come to you. They know about it from the social media aspect, but once you talk to them and tell them more about the procedure, they're very happy, and once they proceed, most of the patients are very satisfied, if not all of them actually. They really know what they want, these patients.
So it's about setting expectations, right?
100%. So they have their own expectations, and it's up to you to see if you meet them or not. It's just about explaining. They come to you, they know already about the procedure.
I think that's what's interesting. Not only social media, I believe with the number of consumers who have performed so far Mia, there is more and more word of mouth happening, and there is more awareness on this procedure. Do you agree?
100%. So most of the people that we see, they are either referred from one of their friends, or they have seen a person who has already done the procedure and they come to do it. They're really excited to come to do it.
Great. Yeah. Dr. Dora, what's different about the implant? I mean, small implants, silicone implants have been forever almost there. So what's the change in the implant being used in the Mia procedure?
There are many innovations in one little diamond-shaped implant. First of all, it's diamond shape. What we mean by that is like there is no front and back side. That means from both sides, the implant can perform the same.
So it doesn't matter how it settles in the breast?
Not at all. Actually, it doesn't matter even if you have strenuous exercise or yoga, or you do headstands, or you do karate, or you do whatever it is, like heavy lifting. Sometimes you experience with the normal implants a flip over. So when this flip over happens, the breast is deformed, and either you can flip it over by luck again, or you need a reoperation. So you eliminate
which
the
you
flip.
Specialize in actually in redos.
Yes, which I love them actually. But
in the Mia case,
it's a pity to do a whole surgery just to flip the implant over again, you know, and then who says that is not going to happen again? So in Mia, it's totally eliminated. You don't have any flipovers, because if it flips over, you don't care because it's the same shape. So that's the diamond part.
But also, thank you, but also on the flip over, there's no white pocket. I mean, I would assume that the possibility of a flip over is quasi not possible in a Mia, can we say?
100%. And I don't think it's just the implant. I think it's also the technique. So to my surprise, when I started doing it, I didn't quite believe the naturality of the sensation. Right?
The sensation.
So I see the patients even after 1 month, and you really cannot feel the implant. So just the concept of tissue preservation, having tissue thickness over the implant, which also, prevents it from flipping. You're not cutting into the breast tissues. makes it so natural to a degree that to be honest, I'm surprised with the results.
So the technology behind the implant is making the difference, but also there is a saying I heard you probably at some point say, less for more.
100%.
What does it mean?
So the implant itself, as Dr. Dora said, the shape of the implant, you put a smaller volume giving a better result. So even if you get the same sized implants, the Mia implant gives more of a volume, if you want to say. So so you'll be using a smaller implant, which makes it more natural.
So can we say that because you're not creating pocket, you're not destroying the breast tissue, you're actually recruiting the
tissue.
And also the implant is diamond shape. It gives more projection once it's inside by creating the tent effect. Am I correct?
It's very simple. Imagine like putting yourself under a blanket. So you go in the bed, you put yourself under a blanket, and then you cover yourself with a blanket. You almost are seamless, right? Like a little bit elevation where your body is, and that's it. Now imagine if you go into a sleeping bag. You try to feed yourself into a sleeping bag, so all the material of the sleeping bag, it's really surrounded by you, it's surrounding you actually. So you have a bigger projection through the level of the ground.
I see.
So this is exactly what it is. Instead of creating a huge pocket to slip the implant inside, you lose the volume, the actual volume of the implant under the blanket. You put the implant in the sleeping bag.
So the implant is completely different from the historical traditional implants,
100%.
Even if it's small in size. You've also spoken about the fact that we now are moving into Preservé. So what are your thoughts about Preservé? Because I strongly believe it's a continuation and addressing another market that is in need of something different. What are your views now, and how excited are you about Preservé?
So I'm very excited about Preservé because sometimes, you get in the clinic the woman who wants to do the Mia but wants slightly bigger sizes. It is treated with the Preservé basically, which also has similar downtimes and everything. And this will open also, the opportunity for women who are not very good candidates for the Mia, in a sense that there are certain cases that the Mia does not treat, and these cases can be done with the Preservé, with the minimal downtime and all of the benefits that you get with the Mia. So I think it's a huge add-on. I think women also have more options to choose from, and I think it's going to be a huge success.
So two different techniques, I would say, Dr. Dora, same great result. And each one of them addresses a certain need, correct?
Absolutely. And I think it's like justice is back. Even like we created
I love your terminologies. The sleeping bag, justice is back.
It's really, because this is how I feel, because I'm a woman. I know what's happening in the market as well, and I can relate. And when you offer the best technology in the world for the people that are not plastic surgery patients, then why you don't offer some technology, at least like the best technology in the world, also for plastic surgery patients? And this is what is addressing actually. Now we can finally address the people that were always interested to have a breast augmentation surgery, not a procedure, let's say, and give them the magic of the minimally invasive procedure, as in Mia, for example.
So less time in the OR, less invasive and faster recovery.
100%.
I always take the example, I'm not a doctor, but I always think appendicitis. Historically, they used to make a cut to do the appendicitis. And now you're going laparoscopic with two small incisions where you do the appendicitis or appendectomy.
And the most important is less complications, like less shape complications that you can see with bigger implants and major cuts and major intervention and major like deformity of the breast and anatomy. So you don't have these deformities anymore.
I remember when we started with Mia, there was the conversation we had before you joined, both of you, with the initial physicians who joined, that it's not addressing all the indications. Obviously, there is no one-stop shop in general for this, but I think now with Preservé coming in, we're complementing what Mia can offer and to what extent, and Preservé can come in and cover that gap.
Absolutely, and I cannot wait to cover also the gap of lifting.
Well, we'll get there.
Yes.
To be honest, I think that the Mia procedure and the implant, as compared to a normal, breast augmentation with the regular implant, does have a slightly higher lifting capacity than the regular implants. I'm seeing it.
It's the whole tissue recruitment.
Exactly, the tissue
because
recruitment.
You're not creating a pocket, there's no void, and you're actually using everything in the breast without destruction, without cautery. I want to thank you both for this insightful conversation. Always a pleasure to have you. And I hope you enjoy the day with what we've prepared.
Thank you very much.
I can't wait.
Same here. Thank you very much.
I just want to add something.
Yes, please.
So I think that other than giving the people or the women what they want, I think that the whole concept that us as a surgeons we take from these procedures kind of changed, for me personally, changed my approach towards breast surgeries. I used to like putting bigger implants. Now when I put a big implant and I look at the woman that I've done, I'm going more towards the natural, so it does change your own
But also it's a consumer
perspective.
behavior. You will see today in the session we've done a lot of research where consumer behavior is shifting towards smaller implants.
Yeah.
So thank you very much.
Thank you,
and
Tim.
enjoy the day.
Thank you very much.
Thank you.
Appreciate it.